Hi, my name is Ma Pamela Tanwanko, and this is my case study on the outbreak of human salmonella, especially in poultry and backyard flocks. The first slide is the background. Salmonella infection is a common bacterial disease that affects the intestinal tract. They typically live in animal and human intestines and are shed through feces. Every year, salmonella causes 1 million foodborne illnesses in the United States, with 19,000 hospitalizations and 380 deaths. There are also risk factors, including ingesting contaminated food or water. This also includes people that are visiting in developing countries where sources may be contaminated. People who are older than 70 years of age and less than 20 years of age are in the highest risk groups. Older people may have underlying diseases and compromised immunity that can lead to higher risk, while children may have less gastric acidity, which allows bacteria to better survive. Eating raw meat is the highest risk factor because salmonella can be cultured from animals and most of their feces contain salmonella. In this second slide, we have the current situation. This year, we saw the largest number of illnesses linked to contact with backyard poultry ever recorded by CDC. Live poultry, such as chickens and ducks, can be carrying salmonella bacteria but appear to be healthy and clean with no signs of illness. In this slide, I included a map of the United States that show people infected with the outbreak strains of salmonella by state residents as of October 5, 2017, which was very recent. I also included the SWOT analysis. The strength is that symptoms develop within 12 to 72 hours, and most cases does not need specific treatment other than adequate hydration. The weakness is there's no vaccine to prevent salmonella infection. Opportunity is taking time to cook poultry properly so the infection does not take place. The threat is that salmonella live in the intestinal tract of humans and animals. Step 3 is prioritizing core issues. As more people are raising backyard flocks and it is becoming more popular, more people are having contact with chickens and ducks. In 2017, CDC and multiple states investigated 10 separate multi state outbreaks of salmonella infections. The outbreak strains of salmonella infected a reported 1120 people in 448 states and the District of Columbia. Illnesses started on dates ranging from January of 2017 to September of 2017. 249 people were hospitalized and one death was reported from North Carolina. Step 4 is analyzing alternatives. According to CDC, mail order hatcheries should provide health related information to owners and potential purchasers before they buy any birds, and this should include information about preventing salmonella infections from contact with live poultry. Mail order hatcheries should participate in the USDA, NPIP, or the National Poultry Improvement Plan, which certify that their flocks are monitored for salmonella bacteria that may cause illness in humans. This includes reducing the incidence of salmonella in day-old poultry in the hatchery, give the poultry industry a better opportunity to reduce the incidence of salmonella in their products. Step 5 is recommendations. For backyard flock owners, always wash hands thoroughly with soap and water right after touching live poultry. Do not let live poultry inside the house, especially in bathrooms, and do not eat or drink in the area where the birds live or roam. Set aside a pair of shoes to wear while taking care of poultry. For stores that sell or display live poultry, place health information in clear view where birds are displayed so that buyers are able to read them. Provide hand washing stations next to poultry display areas and tell customers to wash hands right after leaving these areas. Display poultry out of reach customers, especially children, so customers cannot easily touch them. And also clean the areas where birds are displayed between shipments of new birds. Step 6 is the action plan. So the Food Safety and Inspection Service suggests that modernizing the outdated poultry slaughter system reduce at least 4,286 salmonella illnesses per year. Healthy People 2020 goals and FC's strategic goals include a reduction in the illnesses attributable to FC's regulated products. There is evidence from outbreak data that pork products contribute to illnesses. Decreasing sanitary problems such as the removal of the skin can decrease a source of salmonella on carcasses. FCs will develop standards and, if needed, sampling programs for hog carcasses and pork products in less than 1 year and complete a risk assessment and develop standards for poultry parts. And in my opinion, I believe that salmonella infection is preventative as long as both the consumer and the owners of the flocks are aware of what they are consuming and buying. I believe that bacteria is easy to prevent as long as people have the proper knowledge. Taking extra steps and having the right education can ensure people's safety. This is not just crucial on handling food, but also critical for agricultural practices. Thank you for listening.